Hello and welcome to this week's edition of Healthcare Heroes, where we recognize our dedicated frontline staff and managers. I'm Sandy Potter, joining you today from my home studio, along with Masonicare President and CEO, JP Venoit, and Wallingford Area Home Health Nurse Care Manager, Nicole Ercolani, and her supervisor, Tim Culhane. Thank you all so much for sharing time with us today.
Thanks for having us.
Nicole, let's start with you. You've been out there on the front
Thank you.
You've been out there on the front lines during this pandemic, caring for COVID positive patients in their homes after they've been discharged from the hospital. Can you tell us what this experience has been like for you?
Well, first, I'd like to thank you for this recognition, and I'm honored to be able to share this experience with you. And I want to acknowledge that, as always, the care we provide is a team effort. So I want to acknowledge the therapists, the other nurses working, the schedulers, the supervisors. Everybody has just been in constant communication with one another, as always. So thank you to everyone, and they definitely also deserve recognition for all of their hard work. I think the pandemic has been a unique experience. It's definitely one that I've never had before. It's brought up new challenges for every aspect of healthcare. For a lot of times, people might not know what home care is unless they've experienced it firsthand. So it's you said it perfectly. We provide a safe transition from the hospital setting to the home setting when someone's been discharged. And we have nurses, physical therapy, occupational therapy, social work. There's a lot that goes into coming home from the hospital. Safety and patient care is always a priority, and that is especially true now during the pandemic, when the patients with a COVID diagnosis come home from the hospital. It's crucial that they know the signs and symptoms to look for, that they have access to help if they need it, because these are patients that can deteriorate very quickly and get ill very quickly. A lot of what we do is education. I'll say that's probably 90% of what we do. We just want to empower the patients. We want to provide them with education, make them feel confident that they know what to do when we're not there. They know what to look for, they know who to call. So a lot of it is education. And, we've had to educate ourselves this entire time as well, because things have been changing so rapidly, especially in the beginning. I think we were getting at one point like daily updates of, what to be wearing, how to be documenting things, how to be handling patient care. So it's definitely that communication and education is definitely a big component. We have weekly team meetings where it's a conference call and we call in and we get up-to-date guidance on PPE, CDC guidelines, and staff are able to ask questions. We're able to share experiences. So like if we're seeing a trend with our patients, we're able to share that with, the rest of the team. And I want to thank Allison and Andrea for always being available for my many, many questions. Everyone's just been so great with updating us on what we should be doing. I feel like we've been really supported through this whole thing. In regards to PPE, I know Pat McCoy spoke a little bit to the challenges of getting the PPE. I feel like home care is unique because we're always in a different environment. So we're not in a hospital setting. We go to a home, and it can be anywhere in the community. And so I remember one day, it was like downpouring, the wind was blowing, and I had just pulled into the patient's driveway, and I have to figure out, okay, how do I safely get on all this equipment? And so you have to plan every aspect of your day, and you have to be adaptable and flexible. And I think that in home care, we do that every day regardless. So I think that kind of helped us to get through this pandemic, and as we continue to get through the pandemic, it helps that we're flexible and we're able to adapt to different situations. The stress level has definitely been elevated for our patients who don't have COVID. So we're just there to provide them emotional support, There's a lot of unknown right now, so people get nervous. So, educating them gives them some control over the situation. I think it helps them to relax a little bit, just knowing that they understand what to look for and what to do.
Yeah, that's all great, Nicole, and we can't thank you and your colleagues enough, for everything you've done. And Tim, as the clinical nurse manager, you've been involved closely with all of the patients that we've assisted through our home health services. You must be so proud of Nicole and your entire team.
I'm incredibly proud of Nicole. I have seen Nicole grow so much stronger through this pandemic, but I gotta say, it does take a village. We have great support from upper management, as Nicole touched upon. Allison and Andrea have been giving us great support. Every week we have team meetings with them on a call, and they provide us with all the latest on CDC and DPH guidelines. Pat McCoy has been instrumental in providing us with the PPE, as Nicole stated. So it does take a village, and I gotta say that the team has been so up to this challenge and putting our patients as the number one priority. Yeah.
It's great, JP. I know you're just sitting there with so much to say about the dedication of Nicole and Tim and all of our home health team members. So please take it away.
The amount of even passion hearing from Nicole and Tim is amazing. Our residents and our patients come first, but our staff have done just truly amazing job in putting our patients and residents first, but they're also our largest asset. They're the ones that are delivering on our promise. And just hearing Nicole talk about all the different aspects of taking care of our patients humbles me from the perspective they're the ones doing it. And I'm just amazed and happy to be part of a team that is able to do what they do. Tim, I have to say this, listening to you and seeing what you've done to energize the staff during a stressful time has been amazing. Coming to those drive-through parades, handing out the little treats makes a difference.
Right.
And, the leadership has done a great job across all of our home care company, serving well over 100 patients that have had COVID. But it's all those little things that have really made the difference. Nicole, you talked a little bit about the emotional support. Being there for our patients is critical to really alleviating some of that stress that they may have. And I know I've said this on other of our podcasts, but I ask every single one of our new employees to raise their right hand and make a promise to me. And that promise is never be too busy for the little things, because those little things make such a difference to those that we serve. You both just said the same thing in a different way. And you are making a difference, and you can clearly see that. And watching really you two talk is really an example of the entire team in what they do each and every day. So I can't tell you how proud I am of everything that you two and the rest of the team have done for our patients.
Thank you. Thank you.
Thank you. Thank you.
Absolutely. And Nicole, you had written a very touching email that was shared with us about your experience that you had when you were discharging your first COVID patient who had recovered. Could you share that story with us?
Yes, thank you for asking about it. When I sent that email, I definitely didn't realize that if everyone would see it. I'm glad they did, because we were able to share that experience with me. It was a great time. It was a great experience. I just want to also acknowledge the physical therapist, Jeanette Hawk worked with me on that case. Susan Fagan, Charmin French was a social worker. So it really is always a team effort when we take care of patients, regardless of their diagnosis. For this particular patient, she was very ill when she came home from the hospital. I'd had many other COVID patients, and she was probably the most symptomatic when she first came home. And she lived by herself in a big apartment building, so she had to quarantine herself. She couldn't see anybody, no family. She couldn't see neighbors. They would drop food off at the door for her, but she couldn't have contact with them. I remember our first visit was almost 2 hours long because there's just so much information you need to get and a lot of education. And she also was primarily Spanish speaking. So we had to use the interpreter line just to make sure, I wanted her to be sure that she understood everything I was telling her. And I wanted to make sure I understood everything she was telling me. So that always lengthens the visit a little bit because you have to clarify things to the interpreter. But she was just extremely fatigued, exhausted, even with just conversation. And she's definitely one of those patients that after you leave the house, you're just constantly thinking about them. And so she progressed every day. She got stronger. She worked with therapy. We made visits, and each day she got stronger. And finally, when it came time to discharge her, she was crying, and she was just saying that we were the only people that she saw for a good 2 weeks. And she was alienated from her friends, from her family. And so she was just thankful that we were even willing to go there to see her, because I know she felt very alienated from everyone. I remember her showing me her apartment and how clean she kept it, because I think there's also a stigma with the COVID diagnosis. Her neighbors knew, a couple of her closer neighbors knew she had it. And I think people are a little fearful. And so I felt bad because I think she felt alienated, and she felt, that this stigma, like, I have COVID. And I can't even imagine what that feels like for her. But, we discharged her. She started crying. I was crying. I'm pretty sure the interpreter on the phone was crying. It was just a really emotional day, but it was a great experience. And I think JP said, we always go in and we try our hardest to help patients. And so, when we're able to see that progression, it's just really rewarding. And it's definitely something that I will always remember.
Wow, that's incredible, Nicole. Thank you for sharing that with all of us. I know you didn't realize it was going to go so public, but it's very moving, and we thank you very much.
Your email touched a lot of hearts when you sent it.
Well, thank you. I honestly didn't. We always talk, and we always encourage each other for every patient. So we're in constant communication with the physical therapists, social workers. So, at the end of when we discharge a patient, I always send an email, like if we've really had a difficult case where the patient was sick, I always check in with everyone, and everyone checks in with each other. And that's just how it is at Masonicare. Everybody supports each other. There's constant communication, and patient care is always the top priority. So thank you.
Awesome.
Well, we couldn't have said it better, Nicole. And thank you, Tim, and for the entire team for really exemplifying what it means to be, as JP says, Masonicare strong. I'm Sandy Potter. Thank you so much for watching at home. Please join us next week for another edition of Healthcare Heroes. Until then, be well.